Good afternoon, everyone. I see the number of participants keeps increasing, so we'll wait until we reach some stable, steady number. I think maybe if we give a few more seconds to people to join us, I'm watching the number of participants. It appears that the increase is getting smaller and smaller. So maybe in another half a minute we will get started. Let me apologize for the time being because the captioner is not here, and I know we are working to try to bring the captioner in, so we'll have captions. But I don't understand why I just got text, and I apologize ahead of time. We're trying to resolve this issue. All right, it's 3 minutes past the hour, so I think most of the people who want to join us have already logged in and they're part of that meeting. So we're ready to get started. Good afternoon, everyone. It's my pleasure to welcome you to another town hall meeting. I don't even remember the number by now, but it's the experience that we had in the past is a great opportunity to exchange information and answer questions. Let me start by saying that I'm really very grateful and impressed by the remarkable response that we had by our community at UAC to vaccinations and following safety protocols. It's impressive indeed that as of today, more than 96% of our faculty and staff are vaccinated, and almost 96%, 95.6% of our students are vaccinated. If you add to this the percentage of medical and religious exemptions that we have provided, which are on the order of 2.5%, exactly 2.5% for faculty and staff and 2.6% for students, then the compliance that we have from our entire community is approaching at this point 99%. This is a remarkable result. This is something that I wouldn't be able to predict. I would be delighted to hear this number a few months ago, and I think I speak for all of us. And that shows how much our community cares for each other, and they want to protect themselves, their families, and all the people around them. It shows on our numbers in terms of positivity rates that we are detecting on campus. We had slightly increased rates in the first 2 weeks as the students were coming in from different environments. It was approaching almost 1%. But since the first 2 weeks, it has decreased significantly. It's hovering around 0.5%, less than 0.5%. And this week, now in 900 cases, that they were in 900 tests, there isn't a single positive result that we have seen. This is not inconsistent with what we see across the country. We see the number of cases decreasing across the country. We see the number of cases decreasing in Illinois. I think what these numbers are telling us is that the peak of this wave, and I don't even remember anymore how count these waves, which the fourth wave or the fifth or whatever it is behind us. But as we know, with this pandemic and this disease, probably we'll see another one in the future. But that's a good time right now to have this discussion at this level, provide information, share information, answer questions as we are looking into the future. What is going to happen in the next few months to the extent that we can predict, and what is going to happen in the spring semester as we prepare for the spring semester. And that's the reason that we have this town hall meeting. There are a lot of people that they have information that they would like to share with you. I'm going to be basically the MC of this town hall, so I will be asking them to do the presentations, and then we want to answer as many questions as possible. Some of the questions that they were pre-submitted, they are already worked into the comments that the different speakers are going to make, and some of them that came more recently, and the ones that will get live, we'll try to answer some of them as well. So let me start with Dr. Beris, our Vice Chancellor for Health Affairs, that has one of the experts. And I start with science. From the very beginning, we said we place our trust in science. So I'm counting on Dr. Beris and Dr. Blitzdale, who will follow, to give us an update on the science and the clinical picture of where we are right now. Bob.
Thank you, Chancellor Emeritus, and good afternoon to all of our UIC faculty and staff turning into this town hall. As we've now kicked off the start to another academic year and we turn into the final quarter of 2021, I've recently reflected on the journey we've taken since the beginning of last year, and actually over the So when I walk around campus, people ask me, where are we with the hospital? Where are we with the number of patients? How does this compare to where we were at the start of the pandemic? So let me just give you some numbers. Remember that we saw our first patient February of 2020, February 12th to be exact. And then in April of that year, we rapidly ramped up in the number of patients that we saw. And we got up to 90 patients in the hospital, including 30 patients in the intensive care unit. So it was quite a stress on the hospital, as it was for all hospitals in the United States. But we were able to actually weather that storm. And I have to thank all the faculty, staff for their tremendous efforts and all that they did during that time. And speaking of that time, about 6 months later, we saw another wave in October of 2020. Not quite 90 patients, but we got up to 70 patients. And again, about 24, 25 patients in the intensive care unit. So where are we today? We've essentially plateaued at somewhere between 14, 15, and 16 patients, and 5 patients in the intensive care unit. So as Michael Amritas talked to us, our chancellor, we have seen a decline over the past several months, and now we're in that plateau stage of about 15 to 16%. Having said that, our hospital is 98% full at times from all the referrals that we're getting from over 130 facilities throughout the state of Illinois and beyond. So as anybody who works in the hospital knows, we have been extremely busy. And again, I thank everybody for their incredible efforts to not only care for our COVID patients, but all the other specialty and patients that we're seeing in the hospital. People say, how are we doing on saliva tests? How many have we done? Let me give you the numbers because it's quite impressive. And then I'll give you the number of PCR tests and point of care tests. So as of this morning, we've done 222,000 saliva tests, and our PCR and point of care tests are 153,000. So that's 375,000 tests that we perform to try to keep our campus, our faculty, staff, patients safe in this environment. And sometimes we don't realize, what does this number mean? 375,000. Well, you know, football season started and the Bears are playing at Soldiers Field, and it's 61,000 fans in that stadium when they're full. So if you just put one test per one seat, we filled up that stadium 6 times. So that gives you the enormity of the amount of tests that we've done throughout the course of this pandemic. And I want to thank everybody involved in the testing. It takes quite a number of people just to do one test, and they've worked so hard to try to keep our campus safe. What about vaccinations? Where are we with vaccinations? We've given over 145,000 vaccinations, not only to our patients, staff, faculty, and students, but throughout 15 communities, underserved communities in the city of Chicago. And the mayor specifically asked us to help. So at one time, we were the leading site for vaccinations in the city of Chicago, and then United Center opened, and which overtook us, but it's quite an effort. So now people ask me, okay, are there any treatments? Are there any treatments other than when you get into the hospital? And of course, we know there are. I want to thank Dr. John Radosta and his team. We are giving out a number of monoclonal antibody cocktails. And to date, we've given almost 200 of these cocktails. And very, very few of our patients get admitted once they receive that. So we're very active in using the monoclonal antibodies. We're very proud of the system that we put into place. And I want to thank John Radosta and his team, who has really just done a remarkable job for all of us. And then finally, before I turn this over to Dr. Bleasdale, people ask me, are there any new treatments on the horizon? Anything that's new? And I want to tell you that within the next couple of months, hopefully by the end of the year, there are a number of companies that are working on oral medications, not that will stop the disease or keep you from infecting others, but may help you from hospitalizations. And also it shows significant decrease in deaths in some of the early trials in some of these drugs. So hopefully we'll have some other tools in our armamentarium to fight COVID-19. And please just be on the lookout in the next 2 or 3 weeks, 2 or 3 months for the potential approval of these drugs. And as I said, there's 3 companies working on these drugs as I speak. So looking forward, I anticipate the next evolution of COVID-19 pandemic will be more about how we continue to live with and mitigate outbreaks of the virus. We've certainly come a long way at this point, and I recognize the toll that's taken on every member of our community. However, I do remain optimistic and inspired by the incredible dedication of each of you for collaborating and uniting in new ways to tackle the many issues we have navigated in the course of the pandemic. And I certainly thank you and look forward to a hopeful future. Now, let me turn this over to the Associate Vice Chancellor for Quality and Patient Safety, Dr. Susan Bleasdale, for some remarks. And I really want to thank Dr. Bleasdale. She's worked 24 hours a day for almost 20 months, and we owe her a great debt of gratitude. So, Susan, I know you have some slides that you want to share with us and other remarks. So I'll turn it over to you now, Susan.
Excellent. Thank you, Dr. Barish, and thank you, Chancellor. And thanks for tuning in today for the faculty and staff that are listening to this town hall. Our hope is to be able to give you some information. And in my role, I'd like to share some of the data. Both the Chancellor and Vice Chancellor have mentioned some statistics, which I think it's important to share. Maybe to start with, let me switch this. There we go. Where you can find some of the information. This is on our UIC Today coronavirus on our dashboard. You can go here for all sorts of resources. So I think this is important, as there's a lot of questions that we received around where do I find information around our positivity rate? Where do I go to find out about getting saliva tested? What are opportunities for vaccination? And how do I report if I have a COVID positive result outside of here, or have symptoms, or have travel? And so this is really where you go to find the answers, and also where you go to get information and get some of our data. This is a snapshot from our dashboard today that the Chancellor mentioned as well, that we've had a significant decrease in our positivity rate, and this is since the beginning of this academic year. This shows you what's happening on our campus and in-person activities in general. This is our positivity cases that are broken down by students and employees. So you can see, as the Chancellor mentioned, there was an increase originally as we came together, which I'll go over in further detail, and then a significant decrease as we've gotten into the semester. So this information is really helpful to find out what's happening on the campus, and it's there and updated weekly. What's happening across the country, as the chancellor mentioned as well. We have seen some improvement and some plateau. However, we still are in levels of high community transmission really across the United States, except for some small pockets, but hopefully starting to see some trends. This is within the last 30 days, you can see things are starting to come down in our total cases. Although since the beginning of the pandemic, we have over 43 million cases since the beginning. We also hit an unfortunate mark of 700,000 deaths since the beginning of the pandemic, but within the last 30 days, starting to see some plateau and downward trend. We have 185 million people that have been vaccinated in the United States thus far, which I think is an accomplishment. And now we have already given, since the approval of a booster dose for Pfizer, given over 5 million doses across the country. Again, as was mentioned, there has been some downward trend. This is showing data across the globe of what's happening. And this, as Dr. Barish mentioned, when the hospitals first saw 90 patients, this was the first surge, the green line that we saw in the United States. This is the most recent Delta surge that we have seen. And we are starting to come out of in Chicago and Illinois, at our hospital and across the country. And I think this is really important that we're starting to see a plateau and a downward trend. We have seen infections even in those who have been vaccinated, although those are typically mild symptoms, often mistaken for allergies or sinus trouble. So it's important to know that that still could be COVID and need to be tested, but we do have the addition of vaccine to help prevent from severe disease and decreasing the risk of transmission. There has been hospitalizations with this recent surge, as Dr. Barish had mentioned, not to the same level, thankfully, that we saw early on in the pandemic. And most of that is because of the widespread availability of vaccination to decrease the risk for hospitalization. There are very rare cases of people that are hospitalized that have been vaccinated, but those are typically people with compromising conditions that are not fully protected from vaccination because their immune system is not allowing them to mount a full response to the vaccine. This is why there is a recommendation for a third dose for anyone that has gotten Pfizer or Moderna at day 28. This is different than the booster that you've been hearing about recently. These are people that have severe immune compromising conditions, could be a faculty or a staff member that's receiving medications to suppress the immune system, receiving therapies for cancer, or have something that causes their immune system to be suppressed. We also have boosters available and have a recent recommendation for a booster for those that have completed the Pfizer series. So you've gotten 2 doses of that and it's been 6 months. The recommendation is in particular strongly recommended for those over 65, because as those are over 65, your immune system, again, is not quite as strong and may not be able to sustain a response to the previous vaccination series. So that's a strong recommendation for those over 65 that got 2 doses of Pfizer to get an additional dose at 6 months after completing the first series. Also, for those that are age 50 to 64 that are at risk, it's recommended that you get a booster, meaning you have other medical conditions that put you at risk for severe disease. Now, for the rest, for those 18 to 64, there is a recommendation that if you have occupational risk, you may get a booster of Pfizer at 6 months. And there is some question about what does the may mean that you can get the booster. And really, it's likely that you are still protected at this point because those that are under 65 still likely have some response to the primary vaccination series. However, as a measure of extra protection, the booster at 6 months will ensure that you're fully protected. And so this is available for our staff and our patients that qualify for occupational risk. And these would be people within the educational sector for our faculty and staff, and of course, those in our healthcare setting at UI Health as well. So for staff that were vaccinated at UIC or UI Health, you will get a notification in your MyChart at 6 months that you can schedule to get your third dose of Pfizer vaccine. If you were vaccinated outside of UIC and UI Health, you can call our vaccination number, which I'll put in the chat shortly, but it's 833-53-MyVax. And that's available Monday through Friday, 8 to 5 p.m. to schedule your 6-month Pfizer booster. The other thing I want to remind people is that we are currently entering in what was previously known as the flu season. We had not really seen a flu season last year because of wonderful measures of masking and distancing, but we are gathering together with precautions. We hope we don't see a very significant flu season, but we're not sure. And we want to make sure that we are protected. We have flu shot offerings. Flu shots will be administered in the east and west sides of campus. And again, I'll put this in the chat when I'm finished. But we have 2 dates in particular on October 19th and October 26th that there is flu shot vaccination offerings. The hospital staff, because flu vaccination is a requirement, also have flu shots available through the month of October and can be scheduled through our ImmuWare portal. The other thing I want to highlight is that
Susan, if I can interrupt you just for a second, because that gives me an opportunity to get one question out of the list. There is somebody who asked, is it acceptable to receive the COVID vaccine and the flu shot on the same day?
Yes, and that's a good question. It is. I think in the beginning of when we started to administer the COVID vaccine, it was recommended to space out vaccinations, but subsequently it has been recommended that you can receive them simultaneously. And CDC recommends that you should. If you're there and you can get both, there's not any reason not to get both at the same time. So I think a good question. The other question I think probably that we'll have too is around the boosters. As we're talking about vaccination, I mentioned that flu shots are required for the hospital staff. And of course, the COVID vaccination primary series is a requirement for our students and faculty. But the booster is not a requirement at this time because this is something that is recommended as a potential additional measure of protection, but it's not a requirement. So the other thing I'd like to move on to is, where are we at and where have we been over the last year and a half since the beginning of the pandemic? I want to highlight that through the health science colleges and the hospital have continued to be in person throughout the pandemic. And last academic year, we had many students and staff on the campus for in-person activities last year, and we were able to do this safely. We did not have evidence of transmission related to classroom activities, and that's been really important as now we've come to this fall semester to increase our fall in-person classroom activities. Primarily, cases were related to socialization, break times, where people have an opportunity to take their masks down in close proximity to others. And that is what we had seen throughout the pandemic. And this is why we continue to have masking practices in place now. And in addition, we have the vaccination for further protection. As we've come together this fall semester, we have seen increases in cases, as the chancellor mentioned, and as I showed from the dashboard. This was not unexpected because there were increases that really mirrored the increases in the community in the month of October or August and into the month of September. This is primarily related to the activities that were happening, again, outside the classrooms, that people, the exposures that they had prior to coming to in-person classroom activity. And this is really, I think, related to, there was some confusion outside of the campus in that if you were vaccinated, you could go unmasked. And there was definitely a relaxing of masking practices that people encountered prior to coming back to classroom activities in August. But then, of course, this was reinstated, and I think this really attributes the numbers have come down in the community, and then subsequently the positivity of our students and faculty. We did, through contact tracing, review the first month of positive students that we had. And in the first month, we had 90 students that had attended class during the infectious period. And I think when I say that attending class during the infectious period, that may seem like, why would they attend class when they're infectious? And the infectious period includes the 2 days before the symptom onset, and that is an opportunity for transmission. And so this is important, that people should not attend anything, work, class, when you are symptomatic, but you may attend in those 2 days when you not even know it before you develop symptoms. Again, this is not unexpected because of the activity outside and the community level of positivity, that there would be cases that would be attending class during that period. However, because of masks, we really have not had transmission. And so we reviewed with the contact tracing team those positive cases. There was only one case that may have been related to the classroom activity, but even that was probably highly unlikely because it was at the far end of the incubation period at 14 days. But really, out of 90 positive students attending class, there's only one possible associated case within a classroom. And so I think this really supports the current prevention measures of masking while in class that allows us to continue in-person activities and instruction safely. That's really, I think, important for us, and important for us as we're going to be thinking about the spring semester coming up. I think the faculty and staff, there's lots of questions around when and what sort of information will you get from contact tracing. There is something that will be posted also on the website that I mentioned later today about the kind of frequent questions from faculty about what you can expect from contact tracing. The biggest thing to highlight right now for everyone is if a student attends your class while infectious, you will be contacted as the instructor or faculty member to be asked about masking practices within the classroom, to find out if there was adherence there, and to obtain from you if you have any seating information available. So you will be contacted. If you have a student that wasn't within your classroom during that time period, you will not be contacted. Then they'll use that information from you and from the individual that was positive to try to understand who are the close contacts within that classroom. So who was within 6 feet for more than 15 minutes. And then they will recommend testing for anyone that was considered to be a close contact of a positive case. If for some reason they're unable to identify who the close contacts were, if there's not a seating chart, if they're not able to get more detailed information, there may be an opportunity where they will need to require the whole class to test to make sure that there isn't any potential classroom transmission. But again, those circumstances, we hope as we get more information won't happen, that we'll have to test a whole class. It's important, though, that you have a case in your class does not mean that you need to change your mode of instruction, that you can continue in-person activity. Again, because we have very high levels of vaccination in general, only those who are unvaccinated are required to quarantine. And those who are vaccinated are required to test after an exposure, but they can continue to attend class with masking. And that has been what has been the practice so far this semester. And again, we have not had evidence of transmission from that standpoint. And so I think it's important to understand that with this very targeted rapid contact tracing, we can identify, get people tested, but continue our in-person instruction very well. The other thing to let people know is that on that dashboard that I showed you, that first home page, there is a reporting tool. This is the reporting tool to point you as faculty and staff if you have any symptoms that you need to report and you need to be tested, if you have travel that you need to report, both personal or university sponsored. If you have been tested outside and you need to let us know about your positive test, there is a reporting tool on that home page as well. If you need to be tested, there's resources for saliva testing scheduled or for faculty and staff through University Health Services. I think it's important that we want to make sure anyone reports to us potential exposures outside of the campus, because that helps to make sure that we are safe here within the campus as well. We also are continuing, on top of doing testing of those that are exposed and those that are not vaccinated, that are required to continue to twice a week test. We also are doing some random sampling. And so you may get a notification that your department, your unit has been designated for random sampling. This is to help us to make sure that we are identifying any breakthrough cases despite the vaccination, and help to try to identify people early so that we can understand what's happening across the campus. So you may get an email notification and ask you to go for random saliva sampling test, and then you would go and get that scheduled again on that home page as well. And so those are kind of the information about what's happening and some of the resources that we have available on the site. And again, I'll put some things in the chat as we're finished. I think that's all that I have right now, and then I'll turn it back to the Chancellor for our next speaker.
Before we go there, Susan, and in rapid fire, because that's the way that we will have to answer some of the questions. I saw some on the Q&A that they're very specific to what you said about the vaccines. So there are some very technical, medical questions. Can those who got the Moderna vaccine receive a booster shot?
That's a good question. So right now, the booster shot is only recommended for those that completed the Pfizer series. The need for a Moderna booster is being reviewed this month by the FDA, and we will then likely get some information around recommendations if a booster of Moderna and if a booster of Johnson & Johnson is recommended.
Because that's another, the other question is how about Johnson & Johnson, right?
Yeah, so Johnson & Johnson and Moderna are both being reviewed. The only nuance is that, as I mentioned very early, if you are someone that is very severely immunosuppressed, it is recommended that you get another dose just a month after completing either Moderna or Pfizer. So those are people with cancer getting cancer therapies, people getting medicines to suppress their immune system. That applies to both Moderna and Pfizer, not to Johnson & Johnson right now.
And if there are, we have international students that received other WHO approved vaccines, but none of Pfizer, Moderna, same answer to them, right?
Correct. We don't have any information on the need for boosters for any of the WHO approved vaccines at this time. No.
About the timing, 6 months, 9 months, is there an optimum?
So right now, Pfizer, it's recommended 6 months. So if you're more than 6 months, then you can go ahead and take advantage of that now. If you're less than 6 months, it's really recommended to wait until you get to 6 months. So 6 months right now is what's recommended for Pfizer. I would say there is it may be different based on some of the information that is being submitted from Moderna and Johnson & Johnson. But right now, Pfizer, 6 months after finishing both doses.
And that's a very focused question. If someone received Regeneron, when can the booster be received?
So that's a good question. It's recommended if you were treated with the Regeneron or any of what we call the monoclonal antibodies, it's recommended that you wait at least 90 days before getting the COVID vaccine, either your primary series or the booster shot, that you wait 90 days.
And if somebody got the booster outside of USA, is there any way or reason to get this included in the My Chart?
Yes. And so I would say you can, if you've been vaccinated outside, you can, if you are a patient within UI Health, you can have your provider pull that from the eye care system into your My Chart. When you get vaccinated, we can pull that information into your My Chart account. We can't give you an automated prompt in My Chart if you haven't been vaccinated here. So again, if you've been vaccinated here at 6 months, you should get a My Chart notification that you have an opportunity to be vaccinated. But if it's outside, you just call our 833-53-MyVax, and you can schedule your booster vaccine at 6 months. And when they give it to you, they will go into the eye care system and find your previous vaccination so that they can have it tied all together.
You know, we can have a weekly program together that Ask the Physician will be the title of the program. Thank you, Susan. I appreciate it. We will come back with more questions that they have been submitted, but I thought these were relatively easy to answer. Let me move to Provost Reyes. I don't think Javier, in a few more weeks, he will not need any introduction, but here's the provost to talk about what's going to happen in the spring semester, academic expectations for the spring semester, and anything that changes, any policies that we're going to change in terms of faculty.
Thank you, Chancellor. And first, I want to just extend my gratitude again to all of the faculty and the staff for the incredible work they've done to be flexible, remain flexible, and be kind to our students and ourselves. As we continue to navigate this, we would not be where we are in such a great position if it wasn't for the work of all of us and all of you and really working together. So I appreciate that. And it doesn't go unnoticed that you've been extremely flexible with your understanding and extending kindness to all the students and the faculty and the staff. But quickly, for the rest of spring, I mean, it was important for us to hear from Dr. Blisdell about the contact tracing, that it's a different landscape that we face because of the level of vaccination that we have and the level of compliance that we have. So we really wanted you to hear about some of the contact tracing practices that the team is following. We also know, and I've been told many times, I'm coming from West Virginia, and many times I've been told that winter's coming to Chicago, and that changes a little bit the dynamics of the campus. So we're looking and working with different people across campus to identify spaces where students can go in and as they're taking their synchronous online courses, they need a place where they can sit down, have access to a Wi-Fi, and use, in many cases, I'm going to be very honest, using their headphones, since we don't have a lot of private spaces or enough private spaces for them to use. But I've seen a lot of them at Student Center East. I've seen them in the coffee shop at UH taking their classes, and we're trying to identify other spaces. So we'll be, as part of this, the communication afterwards from this town hall, there'll be the idea of other spaces that we're working with the student affairs, as well as with the library, as well as with the Hall House, for example, and thinking about places that we can make available for our students to do this. The last part is there were some questions about students can come to campus and the exam that it has been already asked on the chat, so I won't go in it. But I do want us to continue to be flexible with our students and continue to be understanding of the changing landscape. I mean, in the US, about 3% of the US population, around that, Dr. Blaisdell can correct me, is immunosuppressed, and therefore we could have some students that can't come to campus because of those reasons, just like we have faculty who cannot and staff. So we continue to be flexible with them as we finish the semester. I've been asked about travel guidance and about the visitor guidance. Please know that there are policies, and the one for travel guidance, for visitor guidance, was put on the chat because it covers the students that would come to class or would come to campus only to take their examinations when they have been fully online for the rest of the semester. And the travel guidelines can also be identified in our website. For the spring semester, I want us to understand that we are under the guidance of the health officials and our health advisors, and resting and relying on science, is that we can have more of our face-to-face courses and more open of our campus. So at the moment, hoping that the trends continue, we're planning to have more of our classes face-to-face. We are not necessarily scheduling the 100+ students online anymore. The auditoriums that were like that, now we're hosting them, or at least scheduling right now face-to-face. It's better to plan for that way, and then if, hopefully, knock on wood, we were to have another wave, we can move back a little bit to online if needed. But we're planning more for face-to-face, and at the same time, we're planning more for the online courses that are fully for online degrees, to not necessarily be synchronous, as what we know is that those students that are looking for the online courses for their online degrees are looking for the flexibility. Now, I know some of those lines were blurred when we were going through the pandemic, and we move a lot of our courses online. Now we have to look at what is the audience for each class that it's supposed to serve. But I don't want us to constrain the creativity of our faculty and the energy that as perhaps is a silver lining of this pandemic that has emerged in many university campuses across the nations, and I want us to continue that at UIC, is that there are innovative ways of teaching that the faculty are exploring with, that require face-to-face components, as well as perhaps hybrid courses or flipped classrooms. So please make sure that we continue to be flexible with all the modes of delivery, but we are expecting to have more of our own campus activities, and therefore our larger auditoriums being fully in use, following all the guidelines that Dr. Blaisdell and Dr. Barish have provided us with. The last part is we're planning, because of the spring, being a higher density in our classrooms and utilizing our larger classrooms. We are working with TJ and his team, and in the innovation side, and with Erin and Kate, and I'm talking to a faculty senate exec tomorrow, and I'm asking in this forum as well, we'll engage some faculty to work with us to how do we work on the contact tracing for the spring, where we're gonna have perhaps larger rooms being used. How can we do it in a way that is conducive of the best practices of teaching and learning that our faculty want to offer, while at the same time being able to implement contact tracing if needed at that point during the spring semester, to maintain the COVID-19 contagion at bay and that it doesn't come to UIC. So we will be working with faculty. We want to hear from you. What are the things that you would like us to try, or the areas the things that you would like us to keep in mind? And of course, what ideas do you have that we can help with the contact tracing? So soon enough, we'll be convening that group. As I said, I'm talking to a faculty senate exec looking for some guidance from the faculty senate, then perhaps also will, I'm sure, include the conversations with the faculty union as well as with the faculty affairs to engage. It can be a very large group, please. It has to be a representative group that we can have some work with and really be ready for the spring to do contact tracing differently, as the environment will be higher density on the classroom, but highly vaccinated and in compliance. So it's a different environment. And I think hopefully this will be the final chapter of our COVID-19 pandemic as we just normalize, hopefully for a better fall next year. So Chancellor, I'll stop there. I don't know if there's specific questions that you may pitch back later to me, or if there's anything in the chat, but I'll stop there and get some guidance.
There are some questions, Javier, that will answer. You will have to answer. We'll answer together with others. But for the time being, thank you, and let me move to Vice Chancellor Rex Tolliver. And Rex, you're going to talk a little bit about student life as well, because the return to normalcy on campus to a large extent is also directly related to student activities in classroom, beyond, and the provost covered the in classroom, but beyond the classroom activities. So where are we this semester, and where are we planning to be in the spring semester?
Thank you, Michael. And let me also say thank you to all of the faculty and staff for your continued engagement with our students. We know how important student engagement is in helping students develop and grow. We know from research that engaged students perform better academically. They have better social and emotional well-being. So again, thank you for the work that you've already done in getting our students back to campus and engaged. Our teams in student affairs have been working very hard with the number of both virtual and in-person events as students have returned to campus. We've already had a number that have gone over very successfully. Our Welcome Back picnic we've had our involvement fair, Spark in the Park. We had over I don't know how many families for our family weekend that we've already had. And I'm happy to report all without incident. Our students are behaving very well. We have instituted some plans to ensure that the environment can be as safe as possible. For any student to attend any of our in-person events, they have to either be vaccinated or have had a negative COVID test within 72 hours. And so that has helped us to maintain a safe environment for our students. And I do encourage our faculty and staff to support our students at some of their events that are coming up for the rest of this semester. We still have homecoming that is coming up. We have our Latinx Heritage Month mixer that will be coming up as well. That will be over at the Forum, and that will be happening. And I encourage you all to please go and check out the student engagement list of programs. I'll type it in the chat as soon as I'm finished so that you'll have opportunity to visit with our students. We're looking at doing even more, of course, in the spring as we continue to pursue more engagement, in-person engagement experiences, again, in a very safe manner. Michael, I would also just like to let the campus community know that we do have students that are on campus. We have nearly 2,900 students who are living in our residence halls each and every day. I'm happy to report that 97% of those students are vaccinated, and we have a very safe campus community. Our students have appreciated the programming that we've been providing for them on campus, and we look forward to continuing to support their out-of-classroom experiences.
And let me add that the student government played a very responsible role at, promoted vaccination, and I think we see our students very unified in supporting these efforts and wanting to have back, as close to as normal was before the pandemic. Thank you, Rex. I'm going to move to Vice Chancellor and there's more coming for you also, Rex, as we go through the questions. But I want to go to the Vice Chancellor for Administrative Services, John Coronado. And John, I know there are a lot of things that you cover, so people want to hear about cleaning standards, about ventilation, health and safety in the classrooms. contractors, also visitors, contractors. But let's start, if you don't mind, with the vaccination of the staff. And I want to answer here one question that we received before the forum, because it's fairly limited, focused and direct, and refers to the UIC police. And it's framed, and rightfully so. There are news and there are reports from police departments across the country that police departments in particular are resisting vaccination. The question was, what about UICPD? Are they required to vaccinate? I can answer this. Yes, they are. They're employees of the university, of course. And are they hesitant or are they in compliance?
Sure. Thank you for that introduction, Michael, and I can certainly answer that. So you already answered the first part. Yes, they are required to comply with our policies. And I can tell you that we have 76 police officers currently on staff, and that group is currently 96% vaccinated. Them, like others on my team, have been coming to campus throughout the pandemic and working, and so they've experienced, firsthand some of the challenges with working in a COVID environment. And I think they really embraced the opportunity to get the vaccine as soon as possible. With that, I'll go into my prepared remarks. So good afternoon, everyone. I do want to thank everyone for joining us today, and more importantly, for your contributions in helping us create a safe space for our community. I thought I'd start off by just saying just how proud I am to be part of the UIC community, particularly when I discuss our COVID response measures since the beginning of the pandemic, and even more importantly, when discussing our staff's response to the vaccination mandate. And I'll use some of my units as an example, which is comprised of about 1,100 employees. In mid-August, we're like the rest of the campus, we're reporting in the 60 to 70% range of vaccination rate. But we recognize that we had a challenge to quickly improve our vaccination rate. And so we really stepped up our communications to ensure that vaccine information was readily available for all who desired it. We also scheduled some vaccination town halls in English and Spanish to present information and to answer any burning questions. And we were very clear regarding the university's expectations for disclosures and either vaccinations or exemption requests. And after all that, I think that the result of all that. Happy to report that since then, within my units, we were able to get over 200 additional staff to report as vaccinated. And my team is currently 91% vaccinated. Also, we had a number of employees who were expressing a desire not to get vaccinated or pursue an exemption, and that number was 32, and now it stands at 4. So that education, coupled with the setting the correct expectations, I think really helped spur gave the impetus for people to get educated and to make their decisions. With respect to COVID impacts on my workforce, I previously mentioned that in these forums that about 35% of my workforce had to isolate or quarantine before because they got COVID or were exposed to someone with COVID. And thankfully, since the vaccination has been introduced and our high vaccination rate, we've significantly improved and are experiencing significantly less workforce disruptions due to COVID isolation and quarantine requirements. And all that means that we can continue our on-site presence in the service of our academic research and healthcare missions. I'll talk a little bit about contractor guidelines, and I'll share a link later with the message to the campus, which really touch on our visitor guidelines in general, but specifically for contractors and vendors. As many of you know, we rely on numerous contractors and vendors to provide products and services in support of these missions. And I want to ensure that that we are working with our contractor partners to make sure that they are aware of and expected to comply with our vaccination and saliva testing requirements in order to continue doing business with us on our campus. So we've been working with the system offices, UIC purchasing and legal to confirm that we can make these requirements within the terms of our agreements. And when necessary, we can sponsor contractor personnel that frequently do work at UIC and get them external affiliate UIC ID cards, so then we can confirm their vaccination status or allow them to participate in our saliva test program. Now I'll move on to cleaning standards and expectations. We did make several adjustments to the building service worker expectations and requirements in order to reduce risks of potentially contaminated surfaces and areas on campus. So our building service workers, they continue cleaning all the spaces that they have been cleaning in the past prior to the pandemic. Plus, we now have introduced the additional responsibility to clean all classrooms on a daily basis. This is all classrooms on campus, not just the general use classrooms that has historically been the case. So now our building service workers are also expected to wipe down frequently touched surfaces such as doorknobs, handles, push plates multiple times per day, and also provide daily cleaning of water fountains, reception areas, and the counters and sinks in our kitchenettes and break rooms. And then I'll also note that centrally located trash and recycling containers are emptied daily and the floors are cleaned weekly. We've also added additional late night work shifts to assist with all these daily cleaning requirements. Our building service workers are also expected to weekly deep clean and sanitize classrooms, restrooms, and elevators using an electrostatic spraying process with hospital grade disinfectant. And this deep cleaning capability is also employed in any space where there may have been a COVID-19 exposure. The cleaning responsibilities for faculty, staff, and students includes private offices, shared workspaces, collaboration spaces, break rooms, and other areas of the kitchenettes and break rooms that have not typically been serviced by building service workers. And we expect that colleges and units will ensure that they have the appropriate cleaning supplies, wipes, and hand sanitizer readily available so that these areas can be cleaned as necessary. And my team is able to help if there's issues in getting those necessary supplies. I'll also share a link regarding ventilation improvements. And that will be shared in our chat here after my remarks. But our team conducted comprehensive assessments, evaluations, and improvements to all our UIC heating and ventilation systems this past summer. And this concludes the regional sites as well. And I'm happy to report that the vast majority of our spaces have adequate ventilation. In all buildings, we were able to significantly increase both the amount of fresh air introduced into each building, as well as the overall ventilation rate throughout the buildings. This means that all our buildings have improved air exchange rates. And we were also able to improve the level of air filtration in many buildings. And we actually tested over 4,200 individual rooms to confirm that the procedures we put in place yielded to the expected results. And out of all that testing, only 32 rooms in 15 buildings required HEPA units to help aid in the filtration and air exchange rate. And our environmental health and safety team remains available to conduct indoor air quality assessments in any rooms that are of concern, and you can contact them directly. They've already completed 29 additional assessments so far this semester, and only 2 of those spaces required HEPA filtration, and we accommodated those as well. Let me wrap up by saying that our environmental health and safety team is also routinely inspecting campus spaces with an emphasis on safety in labs and classrooms. And any identified deficiencies are quickly remedied. And the feedback I get from the team is that we have very high overall compliance with both our mandatory and the recommended COVID safety and mitigation measures. And my team, the administrative services team, is determined to continue being proactive and keeping our spaces as safe as possible for the remainder of the pandemic and beyond. You're always welcome to email me with any concerns you may have regarding our campus facilities or any safety or security issues. And with that, I'll thank everyone, and Chancellor, I'll turn it back to you.
Thank you, John. And there's a number of questions that you will be involved in answering. But before we go there, let's go also to the last person that we have, but one of the most important discussions, and this is Michael Ginsburg, who is, as you know, our Director of HR, Associate Vice Chancellor for Human Resources. Michael, there are two areas that everybody's asking questions about, two policies in particular. One is the vaccination policy, and specifically the enforcement of the disciplinary measures. And the other one is what is new to us is the telecommuting process, and there are a lot of questions that we receive. So try to say as much as you can with this in mind, and then I'm sure we'll leave some blanks that we will have to fill during the Q&A.
So thank you, Chancellor, and good afternoon, everyone, for joining us. So let me start first with reminding everybody about the UIC vaccination policy compliance requirements that we put in place. You'll recall that what we said is that August 23rd was the deadline for employees to document their vaccination status or to initiate a medical or religious exemption. And October 1st was our deadline for employees to be either fully vaccinated or to have an approved exemption. We've been tracking the compliance, and as here are the current statistics. And as the Chancellor had mentioned, almost 99% of our employees have disclosed their status, and 96% are vaccinated. I want to mention, though, that that does not include the hospital, which is being tracked separately and does have different requirements. But if you look at the numbers a little bit more carefully, you note this translates to only 145 employees who have not yet disclosed their status, and only 8 who have actually disclosed that they are unvaccinated. And if you look even further into those numbers, only about a third of that total are faculty, academic, professional, and civil service employees, which means that many of them are temporary employees or other classifications of employees other than our normal group of permanent employees of faculty, AP, and civil service. We're in the process of reviewing all these employees individually, and some of the things that we know about them are that some of these employees are recent hires who still have not had the ability to be able to access health check and document their status. And some of these employees have been working remotely or on a leave of absence. So we're taking a deeper dive into them and asking each of the vice chancellors and deans to take a look a little bit more carefully at who these people are so we can really determine who they are and what the next steps will be. And according to our data, we know that of this 145 or so employees, that only a little less than 30 of them have actually been physically present on the campus over the past 2 weeks, and about half of that group has actually been participating in saliva testing. So you can see that the numbers are pretty small in terms of what the potential risk is on campus. Let me talk about the next steps. So
and Michael, if I may jump in here, I think we can say at this point that it's down to the personal level. We're looking at individuals, a very small number of individuals that we're trying to bring to compliance. Is that correct statement?
Absolutely.
Great.
So let me talk about the next steps. Is that once we have an opportunity to get this individualized information about the employees, we'll determine what the restrictions and or disciplinary measures will be. But we're also going to check in with guidance with the University of Illinois system and try to be congruent with what we're doing at the other universities within the system. Employees, as a reminder, employees who are partially vaccinated, one of the things that we did announce recently is that if they were partially vaccinated as of October 1st, we are going to allow them until the end of the month to complete their second dose. So there may be a few employees who are in this situation as well. This is in alignment with a recent announcement we had through the University System HR office that the leave provisions that were provided by the federal government under the Families First Coronavirus Response Act and the American Rescue Plan Act actually had expired on September 30th, but the university is going to temporarily extend these leave provisions to allow employees time off to be vaccinated or to recover from any reaction to being vaccinated. For new hires, currently we're requiring new hires to disclose their vaccination status or have an approved exemption within 4 weeks of their starting date. We may be looking down the future to changing that to require new employees to have to document that before they start. And we're working on some guidance that we hope will be out later this month to be able to issue about wording to put in job postings and offer letters that will be available to all of our hiring units. And then just as a reminder, our employees who received an approved medical or religious exemption, they're allowed to work on campus, but they must follow the saliva testing requirement, which is twice every 7 days, 48 hours apart. And of course, if they're experiencing any symptoms, must stay home or use personal sick leave time. So next, I'll gravitate to the Chancellor's second point about remote work. And I know many of you have asked questions about remote work and what our policy is and why people are working remotely and what have you. And as a reminder, back in May, when we announced the UIC remote work policy, one of the things we mentioned was this was designed to recognize some of the things that we learned during the early part of the pandemic when people were working remotely and in many cases were able to perform their job appropriately to be able to work remotely and serve the customers that they are able to serve. But as we move more toward the fall semester and as we're now into the fall semester, we've changed the mix of the number of people and who is actually working on campus and who our customers are. And obviously, many more of our students are back on campus. And so one of the things that's important that we noted in that policy is that the decision to allow employees to work remotely, whether it be almost fully remotely or on a hybrid basis, needs to be determined by the operational needs of the department, along with the guidance of the deans or vice chancellors to whom they report. And what we know is that some of our departments are much more public facing than others, serving students, employees, or the general public. And so those units that are forward facing must be staffed in person, while some departments that do not act with others in person can be treated a little bit differently. And what we've guided is that these operational differences can serve as a guidance for departments in terms of determining which employees can work remotely and which cannot. And one of the things that we do know is that according to our disclosure records, over 90% of our employees are actually working on campus. And so there's a very small number that are working on a regular measure full-time remotely. So hopefully that answers all the questions that you have. There may be some others that came in. So Chancellor Amoritas, I'll let me know if there are any others.
Thank you, Michael, and welcome back to you. I think it's time now to go into the Q&A process. One of the most frequent emails that we received following the forums that we had in the past was a very simple question: why was not my question answered? Right? We received over 200 questions before this particular town hall meeting, and there's a number of them now that they're going to the Q&A. So unfortunately, you cannot answer every question. What we have done, however, is taking the 200 questions that we received before the forum, we put them in different areas, in different themes, and we will try to answer at least the general theme. So if your specific question has not been answered, at least we are answering on the topic that you ask, and we're providing information on the topic that you ask, because it's impossible to answer every question. I appreciate that sometimes there are nuances in a specific question that is a little bit different than the general question that we address, but that's the only way to do it. Otherwise, we would have to be here for 7 or 8 hours and give you a slot time for when your question will be answered, because I'm sure you would run away. You wouldn't be tolerating us for that long. So with this in mind, and I'll try to keep the answers short. I have a list here. I have several pieces of paper in front of me. Let's start, first of all, with something simple. Several questions that came in pointed out to the fact that either we're tired of reading your messages, or there are too many messages, or they're not too clear messages, or the messages change, which is, yes, they are changing because the pandemic is changing. The question that is asked, I think, overall, can we have some kind of a virtual space where the university community could find regular updates and all the information? Well, you're not reading our mass emails, obviously. But let me give Dr. Chandra Harris McRae, who is a new Vice Chancellor for Marketing and Communication, give her an opportunity. And Chandra, please share what are we doing in terms of dissemination of information? Where should everybody be going?
Absolutely, Chancellor. Thank you. And I want to add my level of gratitude to all the staff and faculty who have not only been participating, but encouraging compliance. It has not gone unnoticed. To answer the question in regards to the virtual town halls, you can find that all the town halls on the Chancellor's webpage, which is chancellor.uic.edu/video. I will also place that in the chat. And then just for general information, Dr. Blaisdell has already posted this website, which is today.uic.edu/coronavirus. So I will place both of those in the chat. If you have anything that you're needing to know, those are the two places you will always want to check. And I would encourage you to place them as a favorite so that you can easily go back to them when you're looking for information.
And Sandra, the UIC Today site is getting updated, right? Every time that the policy changes, every time that the numbers change, we are updating it. How frequently?
So we're updating as information comes in. The dashboard is getting updated weekly, and that's living there. And so that site really is a house site that links off to all the links and policies that have been addressed in today's forum. So anything changes, that link is likely going to be updated. So you can always go back to that site and click on that link to get the latest and greatest.
Thank you. And those of you who are in administrative positions, please help disseminate this information. Pass this link to the faculty and staff in your units. It helps for everybody. It's a very good source. The data that I had and I talked about at the beginning, I just got it from the website. I didn't have any special data set. I just went to the COVID-19 website and I knew immediately what the vaccination rate and what the cases are. Thank you, Chandra. There is a question that we received also before the town hall, and it has to do with I think it's more of a provost question. Is asking if we're going to expect it to be teaching in non-distance classes in person, and we're health compromised. What is going to happen? And I'm not sure if it's yours, academic, Javier, and there were more than one person who asked that, or if it's a policy more of it. But do you want to answer it, or do we need to bring somebody else to talk about accommodations?
I'm happy to answer, and then, but I do think that it goes down to the accommodation avenue, that faculty and students who are immunocompromised, just like before COVID with other diseases, they were able to request an accommodation. What we ask is that those accommodations are sought out quickly so that then we can have, as the students register for the spring semester, with the schedules about to go live in a couple of weeks, they are really already included into the plans. But yes, we're at the point where it has to be a conversation of accommodations and requested and approved by the teams on campus.
And this has to be a medical accommodation. So being over 65, for example, doesn't mean that you're compromised anymore, especially with the vaccines that we have and everything. But there has to be a medical exemption in this case. Thank you, Javier. Dr. Blaisdell, there was a set of questions that came in that they were around the issue of how do the students report the COVID test results? Where are they reported? Who knows about? Do you want to walk us through this process? If there is a positive test, what's the process after that? What's happening?
Sure. For the students and faculty that are tested here through either saliva testing or through a test through University Health Service, which is not a saliva test, but oftentimes a nasal swab test, that information goes right to the contact tracing team. And so we have the positive results that are going to the contact tracing team, both the CCTEP and the UHS, the University Health Service contact tracing team. But if you are tested—
So just to make sure I get it right, and everybody else gets it right, we know of the positive test at the same time that the students know about the positive test, right?
Yes. Yes, if there's a test that's done here at UIC and UI Health, we know about that positive test. And so
Or
then,
the staff member or the faculty and staff member, whoever is tested through our saliva test.
right. If though you're tested outside, say, something is happening and you get tested close to home, we ask that you enter that into our system. And so if you have a positive test for COVID outside of our system, we don't know about it and we would like to know about it. And so we ask that you report it through at the UIC Today coronavirus site that I put in, and also Vice Chancellor Chandra put in. That has a reporting tool. In that reporting tool, you can enter if you have had a test that's positive for COVID outside of here, either a student or a faculty member. The other thing we ask is I think was a question as well, as if you have a family member that's positive. We ask that you let us know that as well, because when you have someone within your household that has COVID-19, that's really high risk that you're likely going to get it. And we want to make sure that you have the resources to get tested and the guidance on what to do, whether or not you can continue to work or need to quarantine or not. And so that also is pointing you to that reporting tool. The reporting tool is also used for if you have personal travel, you enter it in there, because as we are currently, and still, as I showed that first graph, we're still in a lot of high level community transmission. It's required that you get tested on return from travel, or it may be required that you get tested as you're going for travel. So we can help facilitate that with the contact tracing team through that reporting tool.
And if the test is negative, they don't have to report anything, right? The assumption is that everybody is negative, except in the case of student affairs, if there are some events that the student affairs, for the ones who have exemptions, require a negative test. That's the only time that somebody needs to have a negative test, right?
Correct, yes. And we know about, again, the ones that are done here, we know about the negative test. So if we have someone that's exposed, we have follow-up to know that they have a negative result. But if you have a negative test outside, we don't need to know that. We want to know if you have a positive test, because that would guide your recommendations on campus.
Finally, there was a specific question that came in about who conducts the class when there is a positive case in the class. And apparently it's the instructor at this point, but can contact tracing take this over is the question.
I think we have points of contact within each of the colleges that help facilitate that communication. They've got contact lists of the students and things like that, that in general, the contact is coming from a designated person within a college rather than the instructor. But the contact tracing team will be reaching out to the instructor if there's a positive case within the classroom to get some information. But then the follow-up communication will go to the students through either the contact tracing or a designated contact within each of the colleges.
Yeah, the question that I referred to was saying that I'm getting negative emails back if I report it to the students and their parents get upset with me. Is it possible that something more neutral to the student, not the instructor necessarily? That's something to take under consideration.
Yes.
All right, the next one, Susan, I may need your perspective, but also TJ Augustine, because it goes into, and Vice Chancellor Augustine is here, it goes into the breakthrough, the contact tracing, and specifically the breakthrough tracing. Walk us through that part. Are they using the breakthrough cases the same as they use every other case? What else is done, and how is the contact tracing done? Because quite frankly, I think instead it's a very great benefit that we have. The contact tracing team that we have has done great work right now, and I want with these couple of questions coming in, I want to highlight what they're doing as well.
Maybe I'll start and then TJ can add if there's anything. I think when we say breakthrough cases, so breakthrough case, I think in that term, what we're talking about is those people that have been vaccinated that develop COVID-19 infection. Again, the vaccine is not 100% effective in preventing you from getting infected. Its data suggests that it decreases your risk of getting infected by about 8-fold. So I think that's important to know. And then it probably 25-fold decreases your risk of hospitalization or death. And that's, I think, really important. So it's really important that people still get vaccinated. But again, there's still a chance that you can get it. Oftentimes that is treated the same. If you have an active infection and you get it, even if you're vaccinated, it's still possible that you could transmit it to someone else. So you still, even if you have a breakthrough case, need to isolate for the period of time to make sure that you don't transmit it to anybody else. But I would say most of what we have seen in those breakthrough cases are very mild illness. So it tends to be very mild symptoms. Sometimes people mistake them for, allergies or a sinus pressure, things like that, that it's mild symptoms, but it's still COVID-19 infection. And so we still treat them that they need to isolate. And those people that are exposed to them would need to test as well and would need to quarantine based on their vaccination status. So we are investigating those and treating those as positives. But again, as the number of our campus is vaccinated right now, the number of people that are vaccinated that will have a positive case will be higher, right? Because we're not going to have very many people that are not vaccinated on the campus anymore. So.
See, anything to add?
No, nothing to add to that. I think Dr. Bleasdale took care of it.
And if I compare to what was happening a year ago, the big difference with the breakthrough cases, right, was that last year, if we had somebody who was identified as a positive, all the people who were in contact were quarantined at that point. Now, if you're vaccinated, you're not quarantined anymore because of the low probability. Is that correct?
It is, and also from the risk standpoint, because we have universal masking here, we know masking works. So it's recommended, consistent with CDC's recommendations, that if you're vaccinated and exposed, you don't need to quarantine, you need to wear a mask in public spaces, and then you need to test in that range after your exposure. And so that's what we're happening. And we have the data that shows that even in those that are vaccinated with masking practices on campus, we're not seeing ongoing transmission.
Great. So we adjusted the protocol basically to what we know better now. Right. Thank you. There are some questions that they're directly related to visitors. Let me start with, and I don't know who's going to take these. There were questions about outside groups that they come in, K through 12 students in some cases, either for pre-college programs, initiatives, recruiting issues. Are we going to return to in-person allowing these visits on campus? And Rex, I don't know if a number of them were involved with student affairs or if they're all academic affairs that they were coming in for these outreach programs. Where are we? Are we going to allow them to come in the spring?
So, Mike, I cannot answer on the specific question that was asked for some of the K through 12 because I'm not involved in that. I can say that in some instances, we have had K through 12 programs on the campus already, even through the summer. We hosted them on campus. They were in our classroom, in our residence halls. They had to go through our testing regimens in order to be on campus and have negative tests and be tested regularly while they were here. So I can speak specifically to the ones that we run.
Okay.
That's how we'll continue to operate. But the other side of the house, Javier would have to speak to.
Thank you, Rex. And actually, it was Dr. Bleasdale had some recommendations to share with us with respect to those visits to the campus. That it is my understanding under certain circumstances, protocols are allowed. So I think Dr. Bleasdale has the answer.
Yeah, again, on that website, we have guidance for visitation. So, as we have in-person activity, we can allow certain visitors to the campus safely by just following the guidance. So really, they have to be sort of invited and sponsored by someone on the campus so that they are aware of our recommendations and our guidance. And that would be for masking while they're here on the campus. And for our regular visitors that are coming at a regular interval, we can also sponsor them to have regular testing if they are not vaccinated to ensure additional safety measures. So again, we can have visitors on the campus. We just have to have someone make sure that they are connected to our guidance of testing, vaccination, and masking. And that again is on the website with our visitor guidance, which gives you the protocol and the policy.
Great, thank you. And Javier, there is also a question that is referring to visitors to the library. And it says any more information on when or whether it will allow non-USC affiliated researchers to visit. This is happening right now, right?
Yes.
You may want to talk about the conditions.
if they follow the same visitors guidelines that Dr. Bleasdale referred to, the library, they can come visit the collections if they needed to. I spoke to Dean Ballard about it, and they just have to make their appointment as they usually would have made their appointment. If we're not just allowing people to come on the campus without having a sponsor, which is what Dr. Bleasdale was referring to.
Great, thank you. John Coronado, the issue of vendors or what we call UIC affiliates is a much larger one, right? The library, maybe one person every, I don't know how often they come in, but we have a number of other people that they come to campus as vendors or UIC affiliates. What are we doing with them? What are the requirements that they have to meet before having them on campus?
Sure, that's a great question, and I try to cover that in my remarks. We are working with all these contractors.
One more time.
Yes, right. So we are working with contractors. Vice Chancellor Tolliver has several as well as I do, and I think the bulk probably fall into our two domains. But we've been collaborating with them, and they've been very willing partners in working with us. The big ones I have are security guards and custodial workers. And all our contractor partners have been already started implementing the vaccination requirements and exemption process. And we're getting ready to actually sponsor them for external affiliate ID cards, which will allow them to actually go through, like our staff has done, and students in identifying what and disclosing whether they've been vaccinated or not, uploading their vaccination records, and if they in pursuing medical or religious exemptions, and then participating in saliva testing. So that process has been defined. We have we went through that last semester with the food service workers and some other contractor employees, and we'll continue working that with our other vendors.
Great. Thank you, John. Javier, a number of universities last year said after Thanksgiving we're going fully remotely because we want to avoid the problem of students coming back from home and having the first 2 weeks all over again. One of the questions that we received is, are you considering doing this after Thanksgiving this year?
I mean, just like last year, we didn't consider doing that. This year, we're not as well. And the reason is a lot of our students go home every night and come back. So we are a different type of campus. In other universities, the one where I was formerly, where 80% of the students would travel back home and then come back, that was a different one. But it's at the moment, we're not considering that here at UIC.
Great. Rex, there is a question about food services on campus. Apparently, there were some changes recently in terms of the way that that food is served. And the question is, and we received more than one question along these lines. Can you explain why this has changed, and is this safe?
Yeah, thank you, Michael, for the question. Wasn't really recent. It actually is following the governor's order and the updated guidance that we received for the phase 4 reopening plan, and that guidance did allow for the more self-service buffet style dining that students and others were accustomed to before. Has been deemed safe, and it is in full compliance with the reopening guidelines for food service throughout the state. So that's where that change happened, but that change was brought forth by the governor in the summer.
I might add too, Chancellor, if I can,
Yes,
just about the safety. So, I think that in the beginning of the pandemic, there was a lot of concern about contact transmission of COVID-19, but we've learned so much since last March and February of 2020, and that really primarily the transmission is not related to contact transmission. And it's really taking down your mask. And that's why in the cafeterias or any eating areas, there is hand hygiene sanitation stations at multiple places. So you should be washing your hands before you're getting your food. And then you should be washing your hands before you eat, making sure that people are staying masked while they get their food and really only unmasking when they're sitting and to eat their meal. So this is a safe change, and people should not feel that they're being put at risk by this change in any way. And again, it's consistent with the reopening guidance as well.
Thank you. Michael Ginsburg, a lot of questions about remote work. One of them actually refers to snowbirds and says, if I'm out of state, either temporarily or permanently, can I continue? And is there a problem with changing residency to another state while a remaining employee of the University of Illinois? There is another set of questions who talks about why are we required to be on campus if we don't need to be there to do our job? And then, and I'm loading you, I'm throwing 3 different things here. And then there are some questions that have a notion of people who are not vaccinated actually can stay at home and get paid and perform the work remotely. I think there's a lot of misunderstanding here. Can you please try to clear it out?
Yeah, maybe I'll start with the last one, is that should not be the case, is sending people who are unvaccinated home and reward them, because we have many of our employees who would love to be working from home who are not. And so absolutely, for unvaccinated people, they should not be sent home.
So let's make it clear. Vaccination status is not one of the criteria for working from home.
That is correct. Absolutely correct. Let me address the out-of-state issue. That's actually something that, mostly because of what's happened during the pandemic period, has been on the radar screen for the entire University of Illinois system. And there is a group that's working on a policy to take a look at what all of the key issues are for individuals who would be working out of state. And primarily what drives this is that if people are working out of state, there may be taxation issues that come up that are related to their employment situation. And so we've got the university tax experts and others who are working on a policy, and hopefully sometime within the next month or two, I'd say by the end of the semester, that policy will be made available to the campus so that we can provide that guidance. It is not going to, I'll say the important piece is, it's not going to be out there for the purposes of encouraging people to do that, but it's when those situations do apply and when they do make sense to do it, here's all the parameters that you need to know about in order to make that work. And then, Chancellor, I answered the third and first question, so if you could remind me on the second one.
Well, I can take the second one because it's fairly simple. It says, and there's a set of these questions, says, why is there now a requirement to return to the office when working from home has been working well? And why are required to be on campus if we don't need to be for our job? Well, if somebody works well and they don't need to be at their job, yes, that's a good example for working remotely. The issue here is who makes the decision. Right? It's not what the employee alone thinks, it's what the supervisor thinks as well. So there may be a misunderstanding here that there are employees that they feel, yeah, I don't need to be here. But if the supervisor and the administrative structure thinks, no, you need to be here for X, Y, Z reasons, then they have to be here. Do I miss something here, Michael?
You're absolutely correct. It is the department's obligation to make that decision, not the employee. I think you've said that very succinctly.
Great, thank you. A couple of questions about masks, right? Or not a couple, more than a couple of questions, but a number of questions about masks. And one of them has to do with masks in the future. Are we going to be wearing masks in the spring? Right, and how much longer are we going to be wearing this mask? And what's the trigger to say we don't have to be masked anymore?
I will take that one. And I would say, I think where we're at right now is likely we're going to be masked in the spring semester. We are right now, as I mentioned earlier, coming down from this recent surge that we had in the summer, really, that was August and September. We anticipate that likely we may see an increase in cases through the winter months as not just classes will be in person, but some of the social activities will move indoors, and we anticipate that there may be some ongoing transmission. We don't know yet the impact that more broad vaccination in the community will have on transmission. And so I think at this point, we will anticipate that we will be masked for the spring semester. What will happen next fall, we'll have to see what happens over this winter and spring semester to know where we'll be with masking moving forward.
And then there is the other type of questions, and there are a number of them as well. What do I do when I see somebody who doesn't wear the mask or is not wearing the mask properly? Frankly, I have seen it in many places where people wear the mask like this, right? Which is more like a fashion statement instead of a mask. What do I do in this case? Do I go to them? Do I report? And it's in different manifestations. This question came up. What if it's a coworker? I go to the student center. I see students doing this. What do I do?
Well, let me start with the work setting situation. So hopefully somebody will post. I have a link to where we provided this guidance on the UICHR website back last year. And, it's something that is a multi-step piece is that, first of all, we know everybody has to comply with the requirement. And if an employee refuses to comply, their supervisor should be notified. And it would be best to start with a conversation between the supervisor and the employee, where the employee is reminded of the fact that masks are required. There is a campus policy, and there's a state and Illinois guidelines and federal guidelines as well. And that also in that conversation to remind the employee that masking, goes along with what Dr. Bleasdale said, is not only for the employee's own benefit, but for the health and safety of their coworkers and family members at home. Is we want everybody to comply. During that conversation, the supervisor can certainly ask the employee what the reason is for refusing. And it's possible that the employee may have a medical condition or disability and may have been exempted and have an accommodation. And if they believe that they need an accommodation, have not yet asked for it, they can be referred to the Office for Access and Equity in order to have that discussion. And then finally, if the employee doesn't require an accommodation and still indicates that they're not planning on complying, that's where things get a little sticky, and that's where potential disciplinary action may come about. It's important on disciplinary action to note, depending upon what classification of the employee and whether they're covered by a collective bargaining agreement. And the other thing that can be done, and I'm sure John Coronado can confirm this as well, is that the department could call upon guidance of the Office of Environmental Health and Safety to provide some specific guidance to the department and maybe specifically to that employee. So, I think that kind of covers the employee side, and let somebody else talk about the general campus piece.
I can tell you from my own experience, every time that I have seen somebody without a mask in a student center or in the building, I say, can you please put your mask on? But I say it smiling, I'm not aggressive. And they respond. They put the masks back on if this comment. And I don't think people know who I am in their majority. They're not students that say, oh, the chancellor told me this. It's just they put it on. If somebody doesn't, can you please do that? I haven't seen resistance.
I would just add too, we've been through this in the hospital too, since we've been masking, since the beginning of the pandemic. We do have some tools just how to have that conversation, how to ask people, and that maybe we make that available for the campus, because it really, if you ask people, they will, because it's required, and it's not just required by the campus, but by the state, as Mr. Ginsburg highlighted too.
And I know we are past 2:30 right now. I'm just going to take 3 or 4 or 5 minutes more, because there are a number of questions that they were persistent. Let me ask Susan quickly. There is a question also, if somebody is in the private room without a mask, do they need to close the door?
No. So really this is, if you are at a greater than a 6-foot distance in your private office, you can take it off. I think there was a comment that maybe it wasn't a 6-foot distance, but I think if you're at a distance from someone else in your private space, you can unmask. It's really not about the door, because we're not seeing, again, sustained transmission within the environment. It's really those that are in close contact within 6 feet unmasked for greater than 15 minutes that leads to transmission. So in your private office, you can unmask, and it's not so much about the door as it is about the distance.
Oh, I see. You want to add something quickly? Okay. Javier, there is a question that came up through the pre-meeting questions. It came up on the chat again. On the remote classes, we require the students to come in to take the exam, an exam. Is that true? Is this causing problems for the students and so on? Can you address this?
Thank you for the question. There are classes that from the beginning, the students were informed to read the syllabus, and if they were asked to come take the exams in person, that they would have to follow our policy on sort of that it's part of the visitors guidance that we have. I believe that it has been put in the chat as a response that the students would have to follow that guideline. So that is, but at the same time, just like I've said it in other platforms, the kindness of our faculty and the flexibility that they have expressed and shown to our students, it's fully appreciated. And if there are other ways in which the exam can take place, please feel free to explore it as a faculty member leading that class. If it was part of your syllabus and you had it since the beginning and the students were aware and you want to continue to enforce that policy, well, then the students have to abide by the policy of visitors to the campus to be able to come and take the exam. So that's the current state of affairs there.
Great. And then I'm going to close because we're way beyond our time, but there was one last set of questions that was asking about what is the process, where is the process, and where is the accountability for managing unvaccinated employees? And then there were questions that they were asking about the percentages that we gave already, but there was a specific one which was saying, in terms of religious and medical exceptions, how rigorous was the review? And is this number, I guess the nuance there, is this an excessive number? Are people using these exemptions excessively? And Mike Ginsburg, maybe I need your help, but let me try to answer this. In terms of using, yes, the religious exemptions and the medical exemptions were reviewed. Yes, there was a number of them that they were rejected. The number, or they asked to be restated. The percentage, as I mentioned at the beginning, is on the order of 2.5%. And one way to figure out if this is excessive or not is to compare it with the exemption requests that we received for flu vaccines, specifically in the healthcare delivery system where it's mandatory, right? Or the vaccination exemptions that we receive from students because they're vaccinations that they're mandatory in the dorms. The numbers that we receive for this vaccine are slightly higher in the 2.5%, but they're not excessively higher. Usually what we get for flu vaccines or other vaccines, the exemption percentage is on the order of 1.5 to 2%. So there is nothing there to say that there is an excessive number and an excessive effort that we have. When it comes to responsibility and accountability of the process of managing the unvaccinated employees, this lies with the administrative line, department chairs, unit chairs, and goes up to deans, vice chancellors, and me at the end. As of today, earlier today, we had a distribution of the individuals who are not in compliance right now in terms of faculty and staff that is pushed down to this level. Now, because as we mentioned, this is at the personal level. It's not a big number that we need to make big public statements. They're dealt now as a one-on-one case. Michael, do you want to add something about this? Where is this going? So.
No, the only other thing that I'd add is that we know that there's actually a couple of people on that list who have submitted resignations, and so the list is even smaller than it was when we saw that. And in terms of how you manage those individuals, of course, remember that we are requiring saliva testing for individuals who are unvaccinated and undisclosed for people who are coming to campus. And that, again, it's up to the units to try to manage that. And we've got the data, as I mentioned in my remarks, in terms of who's coming to campus and who is and is not going to saliva testing. And so again, that data is going to be provided to the individual units to try to manage that and do whatever they can to encourage their employees to comply. Once, as I think we've hinted, once as we get down to the numbers with this individualization, we'll make some determinations and provide some guidance to the campus in terms of what the next steps are if we determine the handful of people who really are the individuals at which we're going to have to consider initiating some disciplinary action for.
And let me repeat something that I have said many times in the past to the faculty senate, to similar forums. This is not a punitive action. We're not trying to punish anybody because of what they want or they want to do with the vaccine. This is an effort to protect everyone on campus. And I want to close where I started. I'm really proud of where we are. I'm really proud of how our academic community has responded. I am confident that we are at this point, when it comes to vaccination measures and protection measures, we by far the highest in terms of percentages in the state of Illinois, among the public universities, and probably among all big publics in the country. So that makes me actually very grateful for our academic community, faculty, students, and staff for what you have done and what you continue to do to keep our operations going and support our mission, and at the same time protect each other. I want to thank you for coming today. We will try to answer some of these questions through email as well if we left everything out, and I hope this was informative, and we will have another one in the near future. I hope that as these continue, these town halls, the issue of COVID becomes less and less threatening for all of us. Thank you again.